Hi everyone, welcome back to my YouTube channel. Today we are going to talk about trigeminal neuralgia. So we'll start our topic with introduction. Trigeminal neuralgia, that is also known as trigeminal, is a chronic pain condition affecting the trigeminal nerve and which is responsible for facial sensation. So basically it affects trigeminal nerve that is responsible for facial sensation. Now let's talk about the definition of trigeminal neuralgia. Trigeminal neuralgia is characterized by sudden, severe, and shock-like pain in the face. It typically affects one side of the face and is considered one of the most painful conditions known. Now let's talk about its epidemiology. We will talk about prevalence. Trigeminal neuralgia affects approximately 0.03% to 0.3% of global population. Then we will talk about the epidemiology in age group. So we will see that most commonly trigeminal neuralgia occurs in individuals over 50 years of age. Then if we see the gender predilection, women are more frequently affected by trigeminal neuralgia than men. Now let's talk about the causes of trigeminal neuralgia. The exact cause is not always clear, but common factors include nerve compression, that is when there is contact between blood vessels and trigeminal nerve, and it is causing pressure to it, especially at the level of brainstem. It can lead to irritation and malfunction of the nerve, and that consequently leads to trigeminal neuralgia. Then there are multiple sclerosis that cause demyelination of trigeminal nerve, and it can consequently lead to trigeminal neuralgia. Then there are tumor factors that rarely cause but may compress the trigeminal nerve and can lead to trigeminal neuralgia. So trauma or injury at the face or the facial injuries or surgeries can lead to trigeminal neuralgia. And then there are also idiopathic cause in which the cause is not identified but still the disease happens. So that's the reason they are called as idiopathic cause. Now let's talk about the symptoms of trigeminal neuralgia. The main important symptom on which the basis it is characterized is pain, that is sudden intense stabbing or electric shock like pain, and pain episodes can last from a few seconds to several minutes, and pain is typically unilateral, that means it affects only one side of face. Then another characterizing point about the trigeminal neuralgia is triggering factor. There are activities like chewing, talking, brushing teeth, or even light touch can provoke pain. Then affected areas are their pain is localized to area is supplied by trigeminal nerve, including the cheeks, jaw, teeth, gums, lips, and sometimes the eyes and forehead. As you can see in the diagram, there is one main trigeminal nerve that is giving three branches. One branch is seen in green, that is ophthalmic nerve. Then a purple branch you can see there is maxillary nerve, and the blue branch that is mandibular nerve. If the compression or any problem is demyelination or any problem is at the trigeminal nerve before dividing, then it will affect all three areas of the face, and it will the pain will be over the area of the face, and it is unilateral, so it will be on the one side of whole face. But if affects the one nerve is, for example, if it affects the ophthalmic nerve, the pain will be at the green area. But it affects the maxillary nerve, the pain will be at the purple area. But it affects the mandibular nerve, so pain will be in blue area. So the pain location depends on the branch of trigeminal nerve supplying. Now let's talk about the diagnosis of trigeminal neuralgia. We can do clinical examination that is based on the pain description and its triggers, and then we can do imaging studies that may include MRI, that is used to rule out structural causes like tumors or multiple sclerosis, and we can also do magnetic resonance angiography that helps identify vascular compression of nerve. So to identify the proper cause, we need to do imaging studies. Then we will talk about treatment of trigeminal neuralgia. We can give some medications that may include anticonvulsant, carbamazepine or oxcarbazepine, or the first line treatment in trigeminal neuralgia. Then we can also give muscle relaxant, that may be baclofen, that is used in combination with anticonvulsants. Then we can also give Botox injection that can provide relief in some cases resistant to oral medication. Okay, then we can do surgical options. Then we have surgical options for trigeminal neuralgia that may include microvascular decompression, in which we do remove or relocate blood vessels compressing the nerve. Then we can also do radiofrequency ablation that destroys nerve fibers to reduce pain. Then we can also do gamma knife radiosurgery that delivers targeted radiation to the nerve, and we can also do balloon compression that compresses the nerve to block pain signals. Then we can also do lifestyle adjustment that include avoiding non-triggers such as extreme temperature or facial pressure that may cause or lead to trigeminal neuralgia. Now let's talk about the prognosis of trigeminal neuralgia. It is a chronic condition, but with proper treatment, many patients experience significant relief. Recurrence is possible and long-term management may be required. So this was all about trigeminal neuralgia. If you like our video, don't forget to like, share, subscribe and comment. Thank you for watching.